Hello, I'm Sean Park, prosthetic urologist practicing in Seoul, South Korea. My practice is dedicated to the penile implant, especially inflatables. Today, I'm going to answer one of the questions I frequently got from the patients. Maximizing girth as much as possible is important for me. Is there one brand you recommend for maximizing girth? Is there a way to significantly increase girth? Penile implant is not for so-called size enhancement. Its primary and main goal is for function restoration, erection restoration. Like the patient questioned, there is a chance that the girth will become a little bit better than what they had at the time of the surgery. That's not because the cylinders will do some sort of a girth enhancement. No, it doesn't work like that. Rather, I believe it works like the tissue expander, and since the erectile dysfunction will make the penile size smaller than before, penile implant seems to have some sort of a restoring effect on that. It's not really coming from the girth enhancement, but rather I see it as a girth restoration. In terms of that, both Coloplast and AMS, and now there's a Rigicon as well, all three of them seems to work fine, but Rigicon and the Coloplast seems to have a better girth when it's not inflated. During the flaccid status, both of them has a thicker material, and probably because of that, they have looks like they have a better girth when it's not inflated. But when it's really inflated, I don't think there's a big difference between all three implants. So Rigicon and Coloplast seems to be slightly better, but I can't say there's a huge difference between all three of them. One thing I can tell you is that there is no better implant among all these three. Rather, there is a more fitter implant for each patient cases, because every one of us has a different anatomy down there. Over the course of my experience, it is better to select an implant which could be more beneficial for the patient at the time of surgery, rather than pick some certain brand's implant before the surgery, because we don't know what the patient's anatomy will be. That will be better to be decided inside the OR. Since there's no big difference, all three of them, I prefer to select the implant at the time of surgery. However, if the patient has a Peyronie disease, that's a completely different story. Because of the Peyronie's plaque, all those calcifications and the nodularity scars, the cylinders will need to be very strong and needs to withstand a lot of pressure. So in a case like that, I prefer a Coloplast over the others for now. However, other than that, in terms of the girth restoration, especially when it's inflated, all three implants seem to have a similar impact on it.